The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
So I'm going to start with some updates to the FFY 2018 Child Core Set. 3 new measures were added this year. The first of these measures is the Screening for Depression and Follow-Up Plan ages 12 to 17, or CDF. This measure assesses the percentage of beneficiaries ages 12 to 17 screened for clinical depression, and if the screen is positive, whether a follow-up plan is documented on the date of the positive screen. This measure was already part of the adult core set previously for ages 18 and older, and will now be part of the child core set as well for this younger age group. The second new measure for the child core set is the Contraceptive Care All Women Ages 15 to 20 measure. And this measure has 2 rates. The first is the percentage of women ages 15 to 20 at risk for unintended pregnancy that were provided either a most or moderately effective method of contraception. And the second rate is the percentage of women ages 15 to 20 at risk for unintended pregnancy that were provided a long-acting reversible method of contraception, or LARC. And as Gigi mentioned, this measure was previously reported as part of the Maternal and Infant Health Initiative, and it's now included in both the child and adult core sets for the 2 different age groups. The third new child measure is the asthma medication ratio ages 5 to 18, the AMR measure, which assesses the percentage of beneficiaries ages 5 to 18 who were identified as having persistent asthma that had a ratio of controller medications to total asthma medications of 0.5 or greater. This measure was also added to the adult core set for FFY 2018 for the older age group, which is ages 19 to 64. Additionally, 4 measures were retired from the FFY 2017 core set, and those include the frequency of ongoing prenatal care, medication management for people with asthma, behavioral health risk assessment for pregnant women, and the child and adolescent major depressive disorder suicide risk assessment measures. And now I'll turn it over to Colleen to talk about updates to the adult core set.
Thank you. Next slide, please. So 3 new measures were also added to the adult core set for FFY 2018. The first measure is concurrent use of opioids and benzodiazepines. This measure is the percentage of beneficiaries age 18 and older with concurrent use of prescription opioids and benzodiazepines. The second measure, as Allie just mentioned, is contraceptive care for all women. The adult core set includes ages 21 to 44 in this measure. And the third measure, which was also added to the child core set, is the asthma medication ratio, and this includes ages 19 to 64. In addition to the 3 new measures, there were several substantial updates to existing measures in the adult core set for FFY 2018. The planned all-cause readmissions measure had several updates this year, including the addition of Medicaid-specific risk adjustment. The initiation and engagement of alcohol and other drug abuse or dependence treatment measure now includes stratifications by diagnosis cohort. So separate rates are reported for alcohol abuse and dependence, opioid abuse or dependence, other drug abuse or dependence, and total. Finally, the follow-up after emergency department visit for mental illness or alcohol and other drug abuse or dependence measure was updated to better align with HEDIS. So now separate rates are reported for mental illness and for alcohol and other drug abuse or dependence. Now I'll turn it over to Ella to talk about updates to the Health Home core set.
Thanks, Colleen. Next slide, please. So some of the updates to the adult core set also apply to the Health Home core set. The FFY 2018 updates to the Health Home core set and technical specifications include substantial updates to the PCR measure, including addition of Medicaid-specific risk adjustment, and added stratifications by diagnosis cohort to the IET measure. Next slide, please. There are also a few cross-cutting technical specification updates. We replaced medication tables with online reference to medication lists for several HEDIS measures. We added electronic health record, or EHR, as a data collection method and included links to electronic specifications for several measures, which is new for the adult and child core sets. And we added information about the hospice exclusion where applicable throughout the resource manual, including to guidance for reporting and measure specifications. Next slide, please. And plans for focused technical assistance on the core set measures include a focus on new measures that were close to the 25 state threshold for child and adult FFY 2017 reporting, and measures with major specification changes. And now I'll turn it back over to Colleen and Allie to discuss CMS's focus on data quality.
Thank you. Next slide, please. And one more slide. Thank you. So first, we'd like to provide a recap of the state data quality outreach process for FFY 2017. As many of you know, we conducted systematic data quality outreach to states that reported core set data using the Seek More Information, or SMI, function in MacPro. We want to thank all the states that responded to our questions and provided informative clarifications and feedback. There are many reasons that we reach out to states during the data quality review process, but I want to highlight some of the most common ones. If we see something that looks like a potential data entry or calculation error, we usually ask the states to confirm that the information entered was correct, or to correct the data. Sometimes we also ask for clarification about something that was entered into one of the key data fields or notes fields that was unexpected. This includes rates that are notable outliers from rates reported by other states, or for example, if a rate of 0 was reported. We would also ask about rates or denominators that don't seem consistent with the reported methodology. We also often request more information about delivery system or populations that are included in specific measures. So the more information that states can provide about these topics in MacPro, the better. Finally, if we notice large changes in rates or denominators from what the state reported the previous year, we usually ask about that. I want to emphasize that if you receive questions from us during the SMI process, that does not mean that your state did anything wrong. We ask clarifying questions to nearly every state about some aspect of their core set reporting. The SMI process just helps us to gain a more comprehensive understanding of the nuances of each state's data and also enhances the accuracy of the data reported. This process can also help to increase the number of measures reported, as again, some states are able to report additional measures with more time or technical assistance. So once more, we want to thank all states for the timely, informative feedback that they provided during this process for FFY 2017. Next slide, please. So for FFY 2018, CMS will have a similar focus on data quality. I'm going to review some high-level things that we look for, but if you'd like more detail on any of these issues, there's also an appendix in the slide deck called Tips for Improving Core Set Data Quality in MacPro. So you should be able to refer to this once the slides are sent out after the training. But here are some ways that we can address some of the most common issues with data quality in MacPro. As you enter data into MacPro, you may notice that the system contains some built-in data quality checks to help ensure that the data entered are complete and accurate. For example, for most administrative measures, a numerator cannot be entered that is larger than the denominator. Also, certain measures with multiple rates must have the same denominator for both rates, such as the follow-up after hospitalization for mental illness measure. So you can refer to the data quality checklist to see the list of checks that are implemented in MacPro. These error flags will often show up in red when you try to save a measure or when you try to validate the measure. So sometimes they don't appear right away, but if you notice you are having trouble saving or validating a measure, you may need to scroll up and look for these flags, which often show up as a red box around the data entered. Reviewing these flags during data entry will help improve the quality of data and also facilitate the process of certifying the report in MacPro. As with last year, CMS again plans to conduct outreach using the SMI function. We have listed here on the slide some of the areas that CMS will be focusing on during the data quality outreach process for FFY 2018. These include ensuring the accuracy of start and end dates for the measurement period for each measure. In order to compare data across states, CMS is asking for standard measurement periods to be used. So if you use core set specifications, you can refer to the measurement period table and enter the denominator measurement period for each measure. We also look for consistency of reporting measures calculated using the hybrid method, meaning ensuring that there is complete information on the sample size, denominator, and measure eligible population. We also will focus on calculation and reporting of state-level rates when data are combined from multiple reporting units, such as health plans or programs. Also, documentation of populations excluded from the data. For example, if certain state delivery systems are excluded. So again, the more information that you can provide when reporting, the more helpful that will be. We also look at documentation of any deviations from core set specifications, including use of different age groups, data sources, or methods. Also knowing whether measures were audited or validated, and finally ensuring alignment between core sets for measures that appear in multiple core sets, such as the FUH measure. Next slide, please.
All right, thanks, Colleen. And now I'm going to go over some of the technical assistance resources that have been developed to help states report the child, adult, and health home core sets. So the first thing you'll see listed is the resource manual and technical specifications. And so this document begins with an introduction to the core set and general guidance on some cross-cutting topics related to data collection and reporting. And then the remainder of this document includes step-by-step measure specifications for each of the measures included in that core set, as well as some measure-specific guidance that has been informed by questions the TA team has received from states over the years. The next document you'll see on there is a summary of updates to the resource manuals, and this includes a summary of all the changes to the specifications, including any new measures and any new guidance for reporting that was added. And this document is important for helping to understand any major changes to the existing measures, and this is helpful for understanding changes to calculation or reporting for these measures. The next document on there is the data quality checklist. This includes some data checks to improve the accuracy, consistency, and documentation of the data reported in MacPro. So the checklist contains guidance on how to complete some of the cross-cutting fields in MacPro, as well as measure-specific quality checks. Just as a few examples, it includes guidance on what information states should report when they calculated a measure using the hybrid method, guidance for when a single measure has multiple rates and all of the rates within the measure should have the same denominator, how to report deviations in MacPro, and guidance such as what kind of contextual information states should report in the additional notes field. As Colleen mentioned, many of these validation checks have been built into MacPro, so this document would be good to keep handy when entering your data to help explain some of the validation errors you might be seeing. Next is the measurement period table, which outlines the appropriate measurement periods for the numerator, denominator, and continuous enrollment period according to each measure specification. This resource can help states determine the correct start and end dates to enter into MacPro. And as Colleen mentioned, to ensure consistency between states, CMS encourages states to enter the denominator, start, and end date according to this document, as long as the state followed the core set measure specifications. Additionally, there are a few technical assistance briefs which may be helpful. The hybrid method brief gives an overview of what the hybrid method is and considerations for using this method when calculating measures that have the hybrid method as one of the options for data collection. Additionally, the state-level rates brief is helpful for states who have to combine data from multiple programs or multiple managed care organizations. And it also includes helpful information for how to combine data when, for example, one program might use administrative data and another program might use the hybrid method. Additionally, several core set measures have sample SAS code that has been developed. For example, the child dental sealant measure has sample SAS code, and the SAS code can be requested by emailing the technical assistance mailbox. And each of these resources that I just described are listed in Appendix A with the hyperlink for how to access that resource. Next slide, please. And one more slide, please. So there are two important outreach email addresses to keep in mind when reporting your core set data. The first is the technical assistance mailbox at macqualityta@cms.hhs.gov. And this is the mailbox you should use when you have questions about calculating, reporting, or using the core set measures. And we'd be happy to answer any questions you have or set up a telephone call to discuss your questions. And then the second mailbox on there is macpro_helpdesk@cms.hhs.gov, and this is the appropriate mailbox to contact when you have questions about MacPro or its functionality or accessing the system.
The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.